Imagine waking up one day and realizing that your body is becoming more rigid. Muscles, tendons, and ligaments harden, trapping you inside yourself. Sounds terrifying, right? This is the nightmare reality of a disease that most doctors never see in their lifetime. But what exactly causes this? And is there anything that can stop it? Stay with us as we uncover the chilling truth. Welcome to Levitas. What is fibrodysplasia ossificans progressiva? Fibrodysplasia ossificans progressiva, also known as FOP, is one of the rarest and most debilitating genetic disorders known to medicine and humankind. It turns soft tissues like muscles, tendons, and ligaments into bone, effectively imprisoning the person in their own skeleton. This process is called heterotopic ossification, and in FOP, it happens at an uncontrollable rate. What makes fibrodysplasia ossificans progressiva so devastating is that new bone growth occurs in places where bone shouldn't exist, like across joints, progressively locking them in place. The disease usually starts in early childhood, often with noticeable abnormalities in the toes at birth. As the child grows, flare-ups begin, triggered by minor trauma, infections, or even spontaneous inflammation. These flare-ups cause painful swelling, followed by the rapid formation of new bone. Over time, this results in severe disability as movement becomes increasingly restricted. Even everyday activities like eating, breathing, and speaking become difficult as the disease progresses, leading to a devastating loss of independence. But how fast does this horrifying transformation take place? Let's find out. Fibrodysplasia ossificans. Progressive evolution varies from person to person, but it generally follows a predictable pattern. The first signs usually appear in early childhood, with flare-ups leading to new bone growth in the neck, shoulders, and back. As the disease advances, ossification spreads down the body, progressively restricting movement. By the time a person reaches their 30s or 40s, they may be almost completely immobile. What makes fibrodysplasia ossificans progressiva so aggressive is its genetic nature. The body mistakenly activates bone growth in response to inflammation or injury. This is why even something as minor as a bump, an injection, or surgery can trigger a flare-up. The immune system plays a major role as inflammation fuels the rapid bone formation in the whole body. With every flare-up, the disease tightens its grip, leaving less and less room for movement and more desperation. But what causes this terrifying condition in the first place, and how rare is it? Let's explore. Fibrodysplasia ossificans progressiva is caused by a mutation in the ACVR1 gene, which plays a critical role in bone tissue growth and repair. In people with FOP, this gene mutation causes the body to misinterpret normal signals, leading to an uncontrolled bone formation in soft tissues. Instead of repairing damage the usual way, their bodies build solid bone tissue where it doesn't belong. This condition is so rare that only about 1 in 2 million people worldwide are affected. As of today, fewer than 1,000 known cases exist. Most doctors will never encounter a patient with fibrodysplasia ossificans progressiva, making it incredibly difficult to diagnose and manage. One of the most alarming aspects of FOP is that symptoms often appear in early childhood, meaning children begin losing mobility long before reaching adulthood. There's no way to predict exactly when or where flare-ups will occur, making the disease even more unpredictable and distressing. So, what happens when fibrodysplasia ossificans progressiva reaches its final stages? In the final stages of fibrodysplasia ossificans progressiva, the disease has already locked most of the body's joints, making movement nearly impossible. By this point, even basic tasks like sitting, turning, or holding objects become difficult, if not impossible. Many patients require wheelchairs or must remain in a fixed position due to the extensive bone growth restricting their movements. Breathing becomes a major challenge as new bone forms around the ribcage, which has the ability of limiting the lungs' ability to expand. This often leads to respiratory complications, which are the most common cause of death in FOP patients. Eating and speaking may also become difficult as jaw movement is restricted. As mobility is lost, quality of life is significantly affected. Caregivers must provide assistance at all moments with daily needs, and the risk of infections, pressure sores, and respiratory issues increases. Without treatment, fibrodysplasia ossificans progressiva ultimately results in complete immobility, leaving the patient trapped within their own body. But what treatments are available, and can anything slow the progression of this disease? Currently, there is no cure for FOP, but treatment focuses on managing symptoms and slowing disease progression. The key strategy is preventing flare-ups, as inflammation is the major driver of new bone tissue formation. This means avoiding trauma, infections, and unnecessary medical procedures that could trigger a reaction. Also, chronic inflammation can boost bone formation, making sugar and highly processed foods major contributors. Medications like corticosteroids can help reduce inflammation during flare-ups, potentially minimizing damage. Anti-inflammatory drugs, immune system modulators, and experimental gene therapies are also being explored as potential treatments. Physical therapy can help maintain as much mobility as possible without causing trauma. However, physical exertion must be carefully managed, as excessive movement can trigger new bone growth due to inflammation. Recent research has focused on drugs that target the ACVR1 mutation directly, aiming to prevent the faulty bone growth mechanism. While promising, these treatments are still in experimental stages. Until a breakthrough is found, the best approach remains careful management, avoiding injury, reducing chronic inflammation, and using medications to reduce symptoms. Can surgery help remove extra bone tissue? Unlike other bone conditions, surgery is not an option for fibrodysplasia ossificans progressiva. Attempting to remove extra bone only worsens the condition, as the trauma from surgery triggers even more aggressive bone growth. Instead of solving the problem, it accelerates disease progression, leading to further loss of mobility. Because of this, doctors avoid surgical interventions unless absolutely necessary. The only exception is emergency procedures, such as tracheostomies to help with breathing. However, even these carry significant risks. Since surgery is not a viable option, there are certain supplements that can help slow down this terrifying disease. Let's take a look. How can supplements help stop progression? While supplements cannot cure FOP, they may help slow its progression and support overall bone health. Certain nutrients have been studied for their role in regulating bone growth and inflammation. Here, we will mention the most important. Vitamin D is essential for bone metabolism and immune regulation. Supplementing with vitamin D3 can help maintain balanced calcium levels, reducing the risk of excessive bone formation. Vitamin K2 works alongside vitamin D to direct calcium to bones where it belongs, preventing it from accumulating in soft tissues. Magnesium plays a crucial role in regulating calcium and phosphorus levels, helping to maintain bone and muscle function. Omega-3 fatty acids have strong anti-inflammatory properties, which may help reduce flare-ups and slow disease progression. Curcumin from turmeric is a natural anti-inflammatory compound that can help manage inflammation, a key driver of FOP progression. Mixing it with black pepper improves its absorption and effectivity. While these supplements may offer some benefits, they should be used under medical supervision. The most important strategy remains avoiding trauma and inflammation while supporting overall health with a balanced diet, careful management, and ongoing research into potential treatments. FOP remains one of the most terrifying medical mysteries, but with awareness and advancements in medicine, there is hope for the future. In conclusion, fibrodysplasia ossificans progressiva, also known as FAOP, is a rare and debilitating genetic disorder characterized by the transformation of soft tissues into bone, gradually restricting movement and causing severe disability. Progression of FOP varies, but it typically begins in childhood and worsens with flare-ups that can be triggered by minor trauma or inflammation. The condition is caused by a mutation in the ACVR1 gene, leading to abnormal bone growth. While there is no cure for fibrodysplasia ossificans progressiva, treatment focuses on managing symptoms and preventing flare-ups. Research into potential therapies, including gene treatments, holds promise, but careful management remains key to slowing the progression and improving quality of life. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.